Pediatric thyroid disease from a surgical perspective, most of the time deals with tumors, nodules, masses, cysts of the thyroid gland. Your thyroid gland sits right in the middle of your neck. Sometimes it's picked up by the patient themselves. Sometimes the parent sees something that, whoa, where'd that come from? Sometimes it's picked up by the family practitioner or pediatrician. Other diseases that we deal with also include disease where the thyroid gland may be functioning too much or too little, and sometimes it's just the whole thing is too big and causing symptoms of compression or voice changes, so we have to remove the whole thyroid gland. Sometimes we remove just part, sometimes we remove just the nodule or mass, sometimes we'll stick needles into it and drain cysts. Tumors that grow in the thyroid gland, most of the time they grow so slowly that it just develops over time, and oftentimes even when it's big, you imagine we've seen tumors this big inside a child's neck. You're like, how in the world could it have possibly gotten that big? And we'll remove it, and then the child will say, oh my God, that was really choking me. So it's amazing how well the body can adapt to little things over time. Obviously, something grows quickly, comes to somebody's attention pretty quickly. A lot will depend upon how well the thyroid gland is functioning. So if it's hyper-functioning, meaning too active, or sometimes it can be not active enough. So depending upon what it's doing, you can either have low energy, high energy, hyperactive, high blood pressure, feel your heart racing all the time. Sometimes it'll lead to intestinal symptoms like constipation, heat sensitivity, cold sensitivity, hair loss, skin changes. So there's a lot of things that the thyroid gland is responsible for in our whole body. And as a result, if it's not functioning correctly, you may have those symptoms. What we have here at Boys Town is a multidisciplinary clinic, including an endocrinologist, a pediatric surgeon, and a ENT head and neck surgeon. So by having a whole team here, which is very unique across the region, the patient gets treated from all aspects, whether it's the medical treatment of the gland too much functioning or too little functioning, or if we're dealing with something as serious as thyroid cancer. You have that whole team component, and that's what's been shown to make a difference. Typically, will be in the teenage years. We have certainly seen diseases that mostly run with genetic problems, where you can have thyroid tumors developing as early as the age of 1. So we will run the whole gamut of ages, but if parents are concerned, hey, my child's acting a little bit differently than they were a month ago, either too hyper, getting angry all the time, that may be a sign that there's a problem with the thyroid gland.